most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heine, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about you change this one thing and most shoulder pain goes away. And this is according to my opinion. And
Right.
I bet you your opinion too, Brad.
I'm going to support you, and I think I'm going to have some input. And this is from our clinical experience over the last 30
I
years.
would say 80% of the shoulders I run into have this one problem. By the way, if you're new to our channel, can you step aside a little bit here?
Oh, he's going to hold it.
Please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, you want to go to our website, bobandbrad.com, because we're always giving something away. Right now, we're giving away the Orthopedic Doughnut Pillow by Ergonomic Innovations. I think we're giving away a couple of them.
Yeah.
So these are really cool if you especially have any tailbone pain or any sit bone pain or hemorrhoids, I guess. So
wow, yeah, covers a few
also, you can find it on bobandbrad.com. Pinned to the top of the page. Go to Instagram or Twitter if you want a shorter version of our program. So
60 seconds.
60 seconds a day. So we got the one-arm skeleton here, Sam, and he's going to help us demonstrate here what the shoulder thing that we see that you need to correct.
Right. Show you a little bit of the biomechanics and the anatomy, and it, makes things go better.
Now, unfortunately, what happens quite often with most people is that this occurs because of poor posture. Wouldn't you say, Brad?
Well,
over time.
If it doesn't occur, it certainly, once you got a sore shoulder, it keeps it sore. It's one of the things I address all the time right away.
Yeah. So what happens, especially you tend to see it more if you're right-handed in the right shoulder, is that over time you have a ball of the head of the humerus here, and you have a socket.
Right.
And over time, that ball tends to drift forward.
Yeah, let's show it from this view. So
that's a good idea, Brad.
We call it the anterior direction medically, but forward
kind
towards
of translates
the chest.
Anterior.
There you go.
And the problem with that is that closes up the gap here. And Brad's going to demonstrate that just in a second here. And it can start causing impingement of a tendon.
You're right.
It can also cause impingement of the bursa, so you can get bursitis, tendonitis. It could cause impingement of the rotator cuff itself.
Or the capsule. We get capsulitis.
Right.
A lot of itises going on.
A lot of itises, but a lot of problems. And if it keeps going on, it can eventually cause the tendon to wear out and tear.
Right.
And then you get a rotator cuff tear.
Right.
So lots of problems that Brad's going to demonstrate now.
Right. So here we've got the supraspinatus tendon in pink here. And you can see it goes underneath this bone here, the acromion. And if that catches right there, it pinches. Ow, ow. Now, it doesn't always hurt, but it can wear that out, and it can become painful. And once it's inflamed, then it is painful. And that's why people with impingement, they usually get about to here and it becomes painful. And oftentimes, I got a guy right now.
I have a woman right now that does this.
We've got two people on caseload right now. It's painful, and then once they get it up to here, then it feels a little bit better. And then on the way down,
it hurts.
It hurts too. Very common for impingement.
Another impingement, common one though, is when it just hurts here and it keeps hurting all the way up.
Sure.
Depending on where it is on the tendon is what the difference makes. So the whole thing is, and we're going to show you some things now how to correct this. We're trying to get that ball back in the socket, so there's plenty of room for everything to move.
There you go.
So that's the whole idea behind all these exercises.
All in alignment.
Yep.
Thanks, Sam.
We'll get you your arm back later.
Yep.
All right. The first thing you're going to do is very simply, because this type of posture, I'm exaggerating,
right?
But this type of posture tends to bring that shoulder forward, that ball forward. What we're going to do is we're going to have you just do shoulder squeezes. I have a lady right now that has that impingement. Throughout the day, I just want her to squeeze her shoulder blades together.
Yeah.
And that does two things. One, it strengthens the muscles there to help pull the shoulder blades back and put you in good position. But it also stretches the chest muscles that have tightened up on you.
Right.
So you can do it with like a W.
Yep.
That's a great way to do it because it really stretches everything out. Or, if you don't want to draw attention to yourself, you can just go ahead and do some squeezes that way.
The gentleman I have really severe problem. He's really got a pretty nasty, I don't think it's a full tear, but it's for sure a partial tear. And this exercise makes it feel better all the time. So he's doing this throughout the day.
Yeah, it's crazy. I've had some issues of shoulder myself, and it was interesting that alone took the pain down a little bit.
Yep.
It's amazing. All right, the next one, we're going to actually have to use the booyah stick. Can we have some booyah sticks, please? Thank you. There we go. So you can also use actually this lady that I'm treating. She was watching our videos and she took a broomstick
Broomstick,
and
sure.
cut it off, and then she put tape on the end, which
So
I
it
thought was
wouldn't
it
slip
would
on the
slip. Yeah, I
floor.
thought, hey, that's brilliant.
Very
So,
good.
but if you want to get the real thing, we got the booyah stick down in our comments
Below.
below. Yeah.
Below.
All right. So what you're gonna do here, and Brad invented this. This is called the Statue of Liberty stretch, but he also invented the progressive stretch.
Sure, yes.
So you're responsible for this, Brad.
And this all started from a high school baseball player throwing with overhead problems. And boy, he did it. And he got back to throwing well. And it was like, wow, we got to do this with more people.
Well, it's interesting that sometimes this is all we give people, and sometimes that's all it takes. They
Right,
get better.
sure.
So what I did with her, again, we started off like a little bit lower, and we put it out like this.
So he's talking about the
Lower on the
level of his
right.
shoulder flexion.
And what I did is you have her push down like you're trying to drive the pole down into the ground.
Right.
And while you're driving it down, you lean forward like this.
Yep.
And you go back and forth, do a couple repetitions, maybe up to 5, and then you work your way up.
Yep.
And go do some more repetitions. Repetitions.
It's tough, Bob.
It's the first video of the day.
Yeah.
Give me a break.
Now, one thing we have to emphasize is when you do this and you're pushing down, the pain should drop down. And as you lean forward and flex that shoulder, if it does produce pain, particularly sharp pain, something's not right, and you need to put this exercise off to the side and put a hold on it.
Yeah, or try a different level. Maybe
Right.
try a little lower.
Yep.
But eventually we went way up here with her and just had her do some pressure on, pressure off, or just some straight hangs.
Right.
So
And this, once we get up to that, actually rolls into our hanging program,
right.
which we're not going to get. Are we going to get into that with
Not
this?
today.
Okay, yeah,
No.
that's a little more advanced. Good job.
Interestingly enough, though, and I don't say this is going to happen with you. I mean, what I would do with these people is I first have them try it, and they go, ow, 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 and then come up.
Yeah.
Then we do this,
Hmm.
and we have them do it again. And a lot of times the pain is knocked down. They're already just from one treatment.
Right. So this is what I did with my patient. You probably do this too. Have them flex and say what pain level it is. Do the exercise, maybe 3 times, and then repeat the motion. If it's easier and less pain, that's
a great
telling
sign.
you good sign.
Yep.
Keep doing it.
You're headed
Yep.
on the right path.
Right.
So
it's a before and after test.
all right, this is the one that really helped me. I did this one, but and we call this the chicken wing. Brad
That's Bob's invention.
Yeah, but Brad named it. So from his wrestling days.
Yeah.
So this is a little more complicated. So and some of you won't be able to do this. It's just it's a tough position to put your arm.
Right. Like the gentleman I have, he can't even get his hand
Yeah,
behind here.
Same with the lady I have.
It's
She
a little
can't
more
do it.
advanced.
Yeah.
It's you have,
Especially the younger person. This worked really well with my nephew.
let's say you have normal range of motion, you can reach back to here and to here, but there's pain associated, but you can do it. Then you may be a candidate for
Yeah,
it.
he was a volleyball player, so he had really good motion this way, but he
Mhm.
had really poor motion this way because
Ah.
he's always going like this.
Sure.
And so it really helped him. If you have a shoulder that's prone to dislocations or really loose joints,
Yep.
you shouldn't be doing this one.
Sure. Yeah.
So, but I think what this is doing, it's stretching the back of the shoulder so that it goes back into the socket easier.
Allows that to.
We're stretching this one. So we're putting the pole behind us. I'm grabbing palm out with this side.
Yep, palm. And this is one thing. It's nice to have someone help you if you haven't done this, because I have a lot of patients trying to figure out
Right. How do I get it back there?
Yep.
So that one's palm out. This top one is palm forward. And in this position now, you can work and do a couple of slides up like this, just working on internal rotation here. But then eventually, don't hit the head.
Yeah.
Go on
Switch
the side
hands
of-
once, Bob, so they can see what's going on better.
This hand?
Yep. Yep. So now we can see the stick. So
Sure.
the thumb is up. If you take your thumb, yeah. So your thumb would point up if it's there versus the other way. Good.
And then I bring it up, maybe do a few like this, and then I go ahead and go out and stretch out like this.
Yeah. That's the chicken wing
Yeah.
aspect.
N-
Um,
Now I would, for a while you had me convinced maybe we didn't need to do this one.
yeah.
But when I got a little bit of shoulder pain again, and this is the one that takes it away from me. So it's one person or two people or three people I've had examples that's really worked with. So I got a feeling there's more out there.
Now, so when you do this, we're not going to do this into pain, right?
No, again, never pain.
Right.
Never.
It should feel like a stretch, a reasonable stretch, maybe a little stretch discomfort, but not pain.
Right. And afterwards, it often feels better. I mean, mine, I get immediate results. Like,
So if you do this before, do the chicken wing, how many times?
I only end up doing it like maybe 6 times or so.
Six
Yeah,
repetitions, and
yeah.
then it was easier to do this
Right,
afterwards.
right. I could
Then
tell.
you know you're
Yeah,
right on
you're
the
on the
money.
right path.
Hmm.
So certainly don't make it worse. I
Right.
mean, you might have. I mean, it might be so fired up that it might take a day or two to calm down.
Sure.
But after the exercise, it shouldn't feel worse.
Right.
So,
All right. Keep it
all right.
clear.
Well, booyah. Good luck to you.
Absolutely.